Hi, it's Dr. Nasir here at Lotus Cosmetic Surgery in Westport, Connecticut. One of the most common questions we get is, am I a good candidate for a Brazilian butt lift? Well, there's a lot of things that we take into consideration to determine whether or not you're a good candidate. One of the things is that you should be healthy. If you have medical problems like high blood pressure, we want to make sure your blood pressure is well controlled. We can't do Brazilian butt lifts on smokers. So if you're a smoker, we'd like you to quit at least 4 weeks before and 4 weeks after surgery. If you're diabetic, we need to have your diabetes well controlled before your surgery. And another really important thing is that we want your weight to be within a relatively normal range. In other words, if you're very, very thin or if you're very much overweight, you might not be a great candidate. And we also want your weight to be stable for about 6 months, because your results will vary too much if your weight is going up before the procedure or going down before the procedure. So stable weight is important. And a history of blood clots is also very important. If you have a history of blood clots in yourself or your family, sometimes we'll have you see a hematologist to make sure it's safe for you to have the surgery. And really one of the most important things is having realistic expectations. If you're a very tiny person and you're expecting to have an enormous behind after a Brazilian butt lift and you have hardly any fat, that might not be something that is achievable. So we really need to talk very openly and honestly during the consultations to come up with expectations that are realistic and achievable. At Lotus, we don't treat people, this is not a factory, we treat everybody as an individual, and we look at every individual case and we work with our patients to try and get them the results they're looking for. So if this is something that you're interested in, please give us a call. We'll see if we can help.